What if a machine could roam a pathology slide like a detective, labeling clues and drafting a diagnosis all on its own? Imagine agentic AI that navigates tissue images and writes the report with almost no human prompting. Today, we unpack a bold pilot that tests two general-purpose multimodal AI systems, OpenAI's ChatGPT 5.0 in agentic mode, and H Company's Surfer, as they explore whole slide images on a web viewer and try to describe tissue features and propose diagnoses. The setup is simple but wild: 35 veterinary cases, a slide viewer, and a pair of board-certified pathologists who validate every output. The goal isn't to replace experts, it's to see how far autonomous perception, planning, and tool use can go in a real diagnostic workflow. First question: can these agents analyze slides without signalment, then with organ and species, then with a morphology description, and can they infer a diagnosis from that description alone? The results are instructive, though far from flawless. In the most favorable conditions, the models reach correct provisional diagnoses up to about 28.6% when some context was provided, and up to 68.6% when a morphological description was given. With only the raw image, accuracy dropped to about 5.7%. For comparison, the human expert achieved about 85.7% with a single whole slide image and roughly 88.6% when signalment and organ were available. What does this really show? These are early proof-of-concept tests of agentic vision and language models navigating a real pathology workflow. The systems can explore slides, describe salient structures, and assemble a narrative that a clinician could follow, but they still need expert oversight and careful safeguards. Ethics and safety matter. We're testing in an educational dataset, not routine clinical practice. Still, the experiment sketches a future where AI assistants could co-pilot diagnostic workups, freeing clinicians to focus on nuanced interpretation and patient care. If this sparked your curiosity, hit like, subscribe, and share your questions in the comments. Want the full study? I'll drop a link below. Which scenario surprised you most? No signalment, organ knowledge, or a morphology-driven description? See you next time. Think about the implications for education and research. Students could learn from AI-annotated slides, clinicians could review faster, and labs could triage cases with a safety net. However, bias, data provenance, and the definition of diagnosis must be clarified before any clinical deployment. This study is a spark, not a switch, towards safer, smarter pathology.